Hi, my name is Gabby, and today I'm going to be the massage therapy student for today. So in the case given, the patient was 3 weeks post vastus medialis strain, and the client showed no acute symptoms such as swelling or redness. So the therapist proceeded with the vastus medialis trigger point release, and obviously he followed with the post-treatment trigger point guidelines. So activation of the muscle, followed by stretch, and then lastly followed by heat. And heat is also a great modality to use because it reduces and soothes pain, and it also increases blood flow, which does help with the remodeling, repair, and healing phase. Before you apply heat to the patient, you have to make sure they have no acute symptoms, like I mentioned before, such as swelling and redness and severe pain, things like that. Things like that would be kind of more considered and more suitable for cryotherapy or cold therapy, ice therapy, like we showed in the previous video. And yeah, then you also have to make sure they understand risks and benefits. So, for example, a risk would be that if the therapist leaves the patient unattended, they can burn themselves. And also the benefits. So, some of the benefits is that, again, it'll aid in tissue repair just because of the increased blood flow to the site. Again, so what we do, sorry, I'm kind of filming and I'm holding the camera and kind of doing this at the same time, so bear with me. So to avoid any burning, you would want to make sure you layer the skin properly. You don't want to have just a heating pad with no coverage on the skin, just because that can increase the likelihood of burns. So here I have a really big towel, which I folded in half, and then I folded it in half again. So it's folded twice, and there's a lot of thick padding here. So put that over the vastus medialis and kind of over the whole quad because it fits the whole quad. And then also with my heating pad, make sure it's heated prior to treatment, obviously, to make sure it's warm. On the heating pad, I actually also have a pillowcase on it. So make sure that it surrounds the entirety of the muscle. Okay. And again, if after a couple minutes, if the client does not feel any heat, it may be because the layering is maybe just a little bit too thick, so you might want to unfold your towel, or you might want to remove. Sometimes people put two towels, remove one, and then leave one in there. It's really up to client discretion. You have to really just get feedback from that. So again, so after trigger point treatment or really any kind of heat use, you want to not leave the client unattended just because you want to make sure, burns are not going to happen and you keep getting client feedback, make sure they're okay, just because they can't adjust the heat themselves. So you're in the room getting constant feedback from them. The heat should be on for up to 10 minutes. Again, it can be less than 5 minutes. That's up to the therapist and obviously the client feedback that you get. You kind of know when it kind of gets past the point. Sorry, let me reword that. It kind of, when it's time to take it off, or it's kind of like a little bit, getting a little bit dangerous to kind of use heat, is if the client has kind of excessive redness and sweating. You can kind of check in on their skin just kind of by lifting this up. You can kind of check on their redness level, their sweating. Obviously, if the client says there's burning and they feel burning, you would want to take off the heat. And also, some clients experience itchiness just because the increased blood flow and the increased histamine to the site does cause some itchiness. So that's kind of how you know it's a little bit too much. Yeah, so that would be kind of like signs you would kind of want to be aware of while you are doing your heat treatment or your heat modality within your treatment. So again, after 10 minutes, you can remove the heat, right? Remove the heat, put it back into the hot water kind of canister that some therapists may have, or you just turn off your heating pad, or just put it aside if you're going to use it for later, and then take off the towel, and then again, just proceed with your, your other techniques or things you have planned within your treatment plan. So that is how you would do heat modality that's how you would just do heat modality within your treatment.